Hey YouTubers, are you looking for help with a knee swelling problem? Well, if your knee keeps swelling every time you go do some activity like exercising, doing stuff at home, doing stuff out in the yard, if you keep facing your knee getting a little puffy and achy and you can't bend it or straighten it out all the way, then you're going to want to hear this. I'm going to cover with you today the top 5 reasons for knee swelling. Now, real quick, my name is Dr. David Midoff, and I'm a manual physical therapist over at Paso Manual Physical Therapy. And I've been helping out people with knee problems for years and years and years. So I've seen all kinds of reasons for knee swelling, and I'm going to tell you the top 5. Reason number 1, a meniscus injury. Some people know about the meniscus, some don't. So I'm just going to explain to you what the meniscus is. If you think about the thigh bone coming to meet the shin bone, to form the knee joint. Of course, the kneecaps kind of sit in front of those two. There's a big layer of cushion that's made up of cartilage right between the thigh bone and the shin bone, and that's called the meniscus. You actually have a pair of meniscuses in each knee. So you have what's called a medial and a lateral, or an inner and an outer meniscus. They're C-shaped structures like this, and they're huge chunks of cartilage. Now, the concern with a meniscus injury is that because it's cartilage, it just heals slowly and potentially doesn't heal properly if it's not helped properly, if it's not treated properly. So if you've got a meniscus injury, that can definitely cause swelling in the knee. And the way that that typically presents, the way that it shows up in a knee, is right where the knee bends, usually kind of behind the kneecap, and it wraps around the sides of the kneecap. Sometimes it's on all the way wrapped around all the way to the back of the knee, and it can hurt directly on the back of the knee. That is a common presentation for swelling related to the meniscus. And this is a serious thing. If you've got swelling and it's like what I described and it's related to the meniscus, you don't want to treat this lightly. Wearing a knee brace typically just doesn't help a whole lot. It may alleviate the pain, but taking away the problem for the long term is not going to be helped by the knee brace. It typically requires being seen by an expert and getting expert advice and treatments on how to fix that knee problem. Now, if left untreated, if you keep getting recurring swelling because of a meniscus problem, you have the potential to face a meniscus tear and maybe even need surgery someday, which hopefully you can avoid at all costs. But it is possible to have a painless meniscus tear. In other words, a tear that happened that isn't bothering you at all because it's under control and your knee is working fine. You can have a painless meniscus tear. So just think about that. If you've got a meniscus problem right now, get it taken care of. Go get some help right away. Don't wait too long. Injections won't fix it. That just takes away the pain for a temporary amount of time. And so do pain medications that you take by mouth. So make sure to get professional help if you think that you have a meniscus-related knee swelling problem. Number 2, a ligament injury. So there's tons of ligaments in the knee. What a ligament is, it's a what we call connective tissue. Basically a structure that attaches a bone to a bone. So going back to that example of a thigh bone on a shin bone, you have a bunch of things that tie them together so that the bones don't just fall apart. Those are ligaments. In the knee, you've got some massive ligaments deep inside. The most famous one is called the ACL, the anterior cruciate ligament. There's also the PCL, the MCL, the LCL. There's some other ligaments as well, but those are the main ones that people typically injure. What can happen to those ligaments is they can get overstretched or even completely torn or partially torn, and you bet that causes swelling. Now, if you've got an ACL tear or sub-tear, like a partial tear, or even just an irritation to that ACL ligament, then you can have some pretty significant swelling in the knee. The way that looks is your knee blows up typically. It swells kind of evenly all around the knee where the joint is, where the thigh bone meets the knee bone. Where the thigh bone meets the shin bone, you get swelling on the front of the knee, on the back of the knee, even on the sides of the knee, but typically in the front and back are where people feel it the most. Absolutely, there's a loss of motion. People can't fully bend or straighten their knee. And if it's real bad, they might feel like they need to get on crutches for a while. These types of ligament injuries are typically a result of some sporting accident, like football is a classic one, basketball, volleyball are classics as well. Car accidents, bike accidents, a bad fall can also cause an ACL injury or some other ligament, MCL, LCL injury. Those are all typical reasons for having a ligament injury. But it is possible to get a ligament injury slowly over time without ever having an accident happen. So if that's the case, what you might feel are clicking sensations inside the knee, or feeling like the knee is going to give way, like you stand on it and it doesn't feel, you're not confident in your knee when you go to bend on it or kneel or stand on one leg. You just don't feel confident in that knee. That's typically a sign that you have a loss of stability because your ligaments aren't 100%. So if you've got those signs, the good news is, as long as it's not torn, you have an excellent shot at getting better without surgery. Medications in the short term might help to mask the pain, but they're not going to fix that ligament. Typically, that needs to be braced with a knee brace, and you need some professional help to make sure that the knee brace is only used for a certain time period. You don't want to be relying on the knee brace for the long term. That's not good. And you want to make sure that you don't have anything that's fully torn that may require some sort of procedure by a surgeon or somebody professional that handles that kind of thing. But consult an expert if your ligament injury is not fully going away. We see people with ligament injuries all the time, and they get 100% better. It takes some management. Typically, if it's not too bad, within a month or two, they get a lot better. If it's real bad, it could take 3 to 4 months, but it shouldn't be an ongoing problem that people have for many, many, many months or even years. If that's you, if you think you've had a ligament problem for years, I strongly suggest you get some professional help to nip that in the bud, end it, and make sure your knee's back to normal as best as possible. Left untreated, because you don't have the good stability in the knee, you can begin to irritate the meniscus, you can begin to develop arthritis over time. It's just not a good thing to leave, and it's not a good injury to leave in your knee untreated, because it will begin to cause other problems. Number 3, osteoarthritis, or commonly known as arthritis. There's different types of arthritis. People generally refer to osteoarthritis as arthritis. What that is it's changes, usually age-related. I think it's force-related is what I would call it. But it's changes to the surfaces of the joints. So where the bones meet together, if you think of the thigh bone and the shin bone, and then also the kneecap where it touches the thigh bone, where it moves, there's changes to the surfaces of those bones that cause the surfaces to become not as smooth as they're supposed to be. Joint surfaces should be super duper smooth, very lubricated, so that all the motion can occur there freely without causing you any problems. But if you begin to lose the cartilage on there, if it wears down and you get what's called a bone-on-bone situation, or if the surfaces get bumpy because there's torn cartilage, or the bone is growing inappropriately, like a bone spur or some extra bone growth under the cartilage, then you don't have a smooth surface anymore. Friction becomes a problem within the knee joint, and that's what begins to develop. That's the situation that begins to develop into arthritis. Now, this happens slowly over time generally, so people tend to develop arthritis symptoms as they pass 50 into their 60s, 70s, and beyond. And if it progresses pretty far, people typically have a big loss of motion. They can't bend their knee all the way, or they can't straighten their knee all the way. And sometimes it'll lock, it'll kind of stay in position because of those bumpy surfaces. It doesn't let it move properly. And what needs to happen is we need to look at how the forces are going through the knee, and that needs to be normalized. Now, that's a process that takes a while. Treating arthritis is not a quick thing. If you're out there and you've got arthritis, you might benefit a lot from this program that we offer. It's called the 28-Day Knee Health and Wellness Boost Program. You can find out more about it in the description here. And that program teaches you how to begin to move better if you've got a knee arthritis problem, as well as a meniscus problem, a ligament problem. It helps out a lot of knee injuries, but especially if you've been dealing with a chronic knee arthritis problem, I strongly suggest you check out that program and consider starting it so that you can begin to fix your knee problem on your own at home. Now, if that program doesn't help you out, then I strongly suggest you go get professional help so that you're not in a tough situation later on in life where that knee arthritis has progressed so far that you might be talking about a knee replacement with the surgeon. Reason number 4, a cartilage problem. So we talked earlier about the meniscus, that's a big chunk of cartilage, but we kind of separate that out from other cartilage in the knee. There's tons of cartilage in the knee. The most common cartilage injury that you get outside of the meniscus in the knee is the cartilage on the back surface of the kneecap, on the patella. The kneecap sits directly against the thigh bone, and when you go to bend and straighten your knee, that kneecap travels over the end of the thigh bone, and there's cartilage on both surfaces on the kneecap and on the thigh bone that needs to be there to allow free motion of the kneecap against the thigh bone. That cartilage can get worn down and cause that bone-on-bone situation. And let me just go into that for a second, because I want to make sure that your mind picture, your perception of what bone-on-bone is accurate. Because sometimes people go visit the physician or their orthopedic surgeon, and as soon as the doctor says you got a bone-on-bone in your knee, what I see as a physical therapist, patients coming in here to tell me that their perception is that there is zero cartilage left. There's nothing there, and your knee needs to be replaced. And that's just not the case. In rare, super duper rare circumstances, the cartilage is massively lost throughout the entire joint, but it is extremely rare. I mean, you're talking 1 in a million. What is way more likely is that there's a spot, a tiny spot, maybe like a pinhead, at most like an eraser head of a pencil, that is missing some cartilage. And the bone is now being exposed because the cartilage is so gone there. But what we've been able to do here in the clinic, we do it all the time with patients that have that bone-on-bone situation, is we can change the way that they're moving, change the way that they're putting forces through their knee. We look at muscle imbalances, we look at all kinds of other things. And when they begin to move better and have better strength in muscles that were lacking it for decades, they take pressure off that spot that's bone on bone and begin to put it where it's supposed to be within the knee joint, where the cartilage is thickest, and they feel better and they move better and they begin to recover from that bone on bone situation naturally without medications, injections, or surgery. So cartilage problems can be a huge reason for swelling in the knee. The way that it'll look if you've got swelling related to cartilage on the kneecap specifically is you'll feel swelling right around the kneecap. That's the most common presentation. It'll be tender. If you press the kneecap down and you put some light pressure on it against your thigh bone, that feels terrible. So if you try that out on yourself, just do it very carefully. And as soon as you have a small increase in pain or discomfort, you can be pretty certain that there's a cartilage problem behind your kneecap. Reason number 5 for swelling in your knee, a muscle strain. There's tons of muscles that are right above the knee and then some below the knee, mainly on the back of the leg in the upper calf area. It is possible to strain those muscles to basically overdo some activity, maybe in an instant, like if you took a bad step and caught yourself, or if you exercise, like if you run or bike or maybe even just walk too much, if you're not used to walking as much as you did that one time, it is possible to get a muscle strain. Now that will typically cause lots of intense soreness at the muscle where it hurts and some swelling usually on the muscle itself. So that's easier to manage. Muscle thankfully heals pretty quick. Well, the question that I would ask if you get repetitive swelling in a muscle is there is something wrong with the way that you're moving potentially, or an imbalance of muscle strength around your knee, possibly even up into the hip or down into the foot. So if you get recurring swelling and it's in the muscle, like in the thigh muscles, the quads, or in the calf muscle, there's something not right about the way that you're moving and that strength, that you have an imbalance of strength somewhere. So I would talk to an expert about getting that addressed. If it's just a one-time deal, you swell once, that time you went hiking, then I wouldn't worry about it too much, as long as you're not going to be regularly hiking that hike and it's not getting better. You're not getting more, you're not getting stronger or better in shape to tolerate doing that hike. But if you do the same hike and you're just getting worse, you're swelling more each time, it's not a good situation. Get some professional help for that. A brace typically doesn't help for that much. You've got to make sure that you switch the way that you're walking or change the strength around your knee to fix that situation. Hey, if you thought all this information was helpful for you, I encourage you to give us a like here below and hit the subscribe button right next to it. And if you're looking for more help with knee problems, check out the playlist on our channel page that is all about knee help. We have tons of videos that cover all kinds of different problems related to the knee. Check them out. I'm sure you're going to find something more specific about how to handle a meniscus problem, a ligament problem. All these swelling conditions that we talked about, we go more in depth on in our playlist on our channel. So check that out. Thanks so much for watching. Have a great day, YouTubers. Bye-bye.